Good day, St. Lucie County. My name is Howard Tipton. I serve as your county administrator, and we're here for the COVID-19 update. This is a subject that is front and center on everybody's mind, and so it's important that we have these regular conversations. In a way, all of this is very familiar. It feels like we're here for a hurricane or a briefing that has some of the same messages for a storm event. Stay calm, have a plan, help your neighbor, but there are some unique differences as well with this virus that are important to remember. If we take a storm event, there is, as an example, a focus on, say, 10 or 20 counties in the state that might be impacted. For this virus, we're seeing 3,000 counties around the nation and 200 countries all focusing on possible impacts. The other big difference is the time frames involved. For a hurricane, we usually have 3 to 7 days of preparation, and then we're into recovery mode. The time involved with a virus event is measured in weeks and months. It is all the more important to keep calm and find a pace for yourself and your family that you can sustain. The scale of this event in terms of the attention it is getting is unprecedented, certainly in my lifetime, and so let's talk about it. This morning we have representatives from the healthcare industry, the school board, the cities of Port St. Lucie and Fort Pierce, and of course the county and emergency management. My opening comments are about our community and the time for individual responsibility. Just like in a storm event, we stay calm and we carry on. We understand that we're responsible for our own preparations, making sure you have your medicines, talking with family and friends about communications and other logistics. Talk with your children or grandchildren about what's going on. Communication is key. And with this virus challenge we're facing, we also have the responsibility to work together to keep people healthy and to minimize the spread of COVID-19. We all have a role to play in this. With that, let me introduce Clint Sperber, our St. Lucie County Health Department Director, and he has two guests with him as well. Clint?
Thank you, Howard. With me today is Dr. Ian Boykin, our medical director, and then also Eric Ullman, who's the director of Longwood Regional Medical Center and Heart Institute. As I speak, there are no cases of COVID-19 in St. Lucie County. What we need to remember is COVID is not the flu or influenza. Currently, there's no treatment if you have it, and there's no vaccine to prevent it. Older people and people of all ages with severe underlying health conditions like heart disease, lung disease, and diabetes, for example, seem to be at higher risk of developing serious COVID-19 illness. If you are at a higher risk for serious illness because of your age or because you have a serious long-term health problem, it is extra important for you to take action to reduce your risk of getting sick with this disease. A major concern we all have in the medical community is how many people will get sick at the same time. Our main objectives in public health and as a medical community are to limit human-to-human transmission, identify, isolate, and care for patients early, to reinforce important public health messaging like symptom monitoring, infection prevention, and stopping or slowing down the spread of disease to keep you safe if you come into contact with someone with COVID-19 or other viral respiratory pathogens like the flu. Eventually, when a vaccine is developed, to vaccinate everyone in the community who wants to be vaccinated using the Centers for Disease Control guidelines. So to help the health department have a pulse of disease in St. Lucie County and providing scientific guidance and recommendations, I think it's important for everyone to understand we monitor influenza activity throughout the county. We review emergency visits for dozens of complaints like influenza and pneumonia, and we also monitor school absenteeism. Now with mass gatherings, we have seen across the country a lot of direction. What we are urging as a Department of Health is for any attendees of mass gatherings not to attend if you are a contact to a known or suspected case of COVID-19, are over the age of 65 with underlying health conditions, are immune compromised, are ill, have been exposed to someone with a respiratory illness in the last 14 days, have chronic health conditions such as heart disease, diabetes, or lung disease, have traveled internationally within the last 14 days, especially to destinations under Level 3 travel advisory, have traveled to or from a geographic area with widespread community transmission of COVID-ID. Now, with mass gatherings, the Centers for Disease Control defines it as a gathering of 1,000 individuals or more. There's been a lot of questions also about testing. So with testing kits, Governor DeSantis just announced that the state has ordered an additional 2,500 test kits to supplement the adequate resources already available to test for the virus. These additional test kits will enable Department of Health working with Florida healthcare providers to test up to an additional 625,000 individuals. As Howard already mentioned, and you will hear shortly after me, is everyone plays a part in lowering the impact within our communities and workplaces. Taking everyday preventive actions helps us to impede the spread of respiratory diseases like COVID-19. Preventative actions include washing your hands frequently with soap and water for at least 20 seconds. Avoid close contact, and we just spoke about that. Staying home when you are sick. This message cannot be emphasized enough. And before traveling, take certain steps. Follow the CDC travel recommendations. Now, the Department of Health has set up a dedicated COVID-19 call center for questions about the virus. Anyone with questions can call. It's a toll-free number, and it's open 24 hours a day, 7 days a week. It's 866-779-6121, or you can email covid-19@flhealth.gov.
I would just like to urge everyone to not panic. This is a disease that we will do everything that we can to make sure everybody is safe. We would like to ask everyone that if you do feel ill, make sure that you try to call your primary care provider. Do not rush to the hospital, as not everyone that becomes ill requires hospitalization. If you develop a fever, chills, cough, shortness of breath, give your primary care provider a call. Make sure that you let their offices know what's going on, what your symptoms are. That way we can prepare for you to come to the offices and be evaluated. We are able to begin testing on an outpatient basis at outpatient labs, as well as a high-risk patient would be directed directly to the Department of Health. We have things in place at offices so that if you do call ahead, we're able to get you in, possibly through a side door or without having to wait in a waiting room with other patients. So it's extremely important that you do call ahead and let us know. Everyone should do their part in preventing this disease from spreading as much as possible. We want to make sure, as Clint had already mentioned, that you wash your hands. This disease cannot spread through your hands. It must be contacted up into the respiratory system. So as long as you wash your hands and you do not touch your face, when you bring the virus from your hands up to your face, whether it's through your eyes, your nose, or into your mouth, that is how you can obtain the disease. So I would urge everyone to do all of what they can to prevent this disease. And as Clint already had mentioned, avoid large gatherings. The disease can spread very easily when you are in a large group.
Okay. Once again, my name is Eric Goldman. I'm the Chief Executive Officer of Lawnwood Regional Medical Center. And I think the important thing that we want people to know is that the hospitals in this community are open and available for everybody should you need care. But I think Dr. Boykin brings up a very important point in that what we can't do and what the attempt to do for many of the things that you've heard this morning is an attempt to slow down the process of people obtaining COVID-19. The reality of the situation is if we don't do that, we are going to begin stressing all of our medical facilities beyond our capacity, and we don't want to be in that situation. So really, I hear online from people talking, saying, "Oh, this is being blown out of proportion. You're probably not even going to feel any symptoms." You may feel symptoms, you may not feel symptoms. You may be critically ill, you may not be critically ill. But what we do know from the numbers is that a great deal of people will fall ill, and as a result of that, that we need to make sure that we have all of the services necessary in order to be able to deliver the world-class care that everybody in this community deserves. And I think that's one of the most important things that we can do. So while you may be feeling fine, you don't know who the person is next to you. You could be a carrier. You might have the virus and be able to pass it on to somebody else who is not going to be as fortunate as you. And so that's really what we want to stress more than anything, is to take this seriously. Please do not get your information from social media. There's a variety of different opinions that are out there. We urge you to seek facts. We urge you to be able to watch the news and make the appropriate decisions that I know everybody's capable of making. That being said, from the hospital perspective, we have been working with our staffs. We have all the personal protective gear that we need, and so we feel that we are well suited to be able to care for patients. What we really want to do is limit the hysteria in the community. So to the extent that everybody's capable of doing that, I think we can all get through this event very well. But it's going to take cooperation, people working together, and as Clint mentioned, this is a public health emergency, not a personal health emergency. And so what that means is that we have to take into account each and every individual that lives in this community, participates in this community, and make sure that we're doing not just the right things for ourselves personally, but for the community as well.
Thank you, gentlemen. On the screen in front of you, we have a graph that's called Flattening the Curve. And when you read about the events that are unfolding, you think about Disney closing, you think about Major League Baseball postponing their season, their spring training. These events are done, and I think that this graph kind of symbolizes why they're doing that. We need to be taking the protective measures, as Eric just said, so that our healthcare systems are not overwhelmed and that we can treat everybody who needs to be treated, and that's the goal. And so I think as you take a look at this graph, it shares with you, I think, very visually why we are all sharing this information and why it's important for you to follow the advice that's being shared. And so, gentlemen, I thank you very much for being here this morning. We appreciate that. And next up, we're going to talk about another area that is near and dear to many in our community, and that is the school system. And so with us, we have Wayne Gent, our school superintendent, and he will provide an update from the school's perspective.
Well, thank you, Mr. Tipton, for the opportunity to inform our public, especially our parents. At the school district, we've been very active over the last several weeks. We think that we need to be as proactive as we can be so that we don't have to be in a reactive position later on. As everyone's aware, today is Friday the 13th, and this will be the last day before spring break, so we think it's a great time for the spring break. We have taken precautions in our school centers with cleaning our schools, making sure we've got backup custodians in case there's substitutes. We've been cleaning our buses. We just received 600 hand sanitizing equipment like you see in the hospitals, and that was distributed yesterday to our school centers as well. So we've tried to stay on top of that and have our students make sure we've inundated this in their heads to practice good hygiene, as you've heard a few moments ago, to keep, to cover your coughs, to stay home if you're sick. That's for students and staff members. As we go into spring break, one of the main questions right now is what happens if school closes? And we do not anticipate that occurring. We have our teachers coming back on the 23rd, March 23rd. We anticipate our students coming back on the 24th. In case something were to occur and the state recommends that, or for any reason that we would need to close, then we are prepared to have online coursework that would be available to the students. information went out this week to the parents, particularly at the elementary level, to make sure that we have an updated email address so that our teachers will be able to distribute online lessons that the students are very familiar with. We do iReady and we do other programs as well. So we feel like in the worst case scenario, if that were to occur, that we're ready and that we could continue the education. There's nothing better than a teacher in front of a student in the classroom, but we do have a contingency plan. Many of our boys and girls qualify for free and reduced lunch, and for some of them, the school lunch is the most important meal they receive all day. So we have contingency plans in place as well to be able to provide food for students in the community, and are working with different agencies as well on that. In the area of student travel and employee travel, we've really encouraged, we have really stopped all of our out-of-state travel. We did that earlier this week, and we also put a stop on all in-state travel on field trips for next week as well, particularly after the governor came out with his information yesterday regarding large gatherings, and we had a couple of schools that were going to go to some of the amusement parks. So those have all been put on hold and been put on pause for the time being. We've also encouraged our staff members to follow the CDC and Health Department guidelines as it is required for international travel. If any of our employees or students travel internationally and come back, we're not going to allow them back in school for 14 days to make sure that it's just an added precaution to make sure that we protect our students. But as I have stated, we have been in contact with the governor's office, with the state surgeon general, with the local health department, and following CDC guidelines. We also work closely with the other school districts to make sure that we're aware of what they're doing, and we feel very confident that we have done a good job in protecting our children. We want them to practice good hygiene. We need for folks as well, particularly our students and parents, to take to social media. The facts are this, that we are going to reopen school right now as scheduled. We are not extending spring break. We will continue to monitor the situation every day and take the guidance from the Department of Education as well. So we just want folks to remain calm and to practice good hygiene. We will be available next week to answer questions. Continue to monitor our district webpage because it is updated as needed, but each day it's updated with latest information, and there are links on there as well that parents can utilize to find out what's happening and any recommendations that we would have at that time. So continue to monitor that and monitor local news media. Thank you, Howard.
Thank you, Mr. Gent. We appreciate that. As I said earlier, there is nothing more important than the safety and security of our children, and we appreciate your diligence in keeping the community informed. Thank you. I also have joining us our two city managers, the city of Fort Pierce, Nick Mims, and the city of Port St. Lucie, Russ Blackburn. And we want to just talk a little bit about local government services if we can. Our focus at the county level is to ensure that all essential services continue to be provided and that we remain open for business. From an emergency management perspective, we are at level 3, which is our lowest activation level, and monitoring events with the possibility of moving to a level 2 activation similar to the State Emergency Operations Center. We are all picking up the trash, making sure water and wastewater are in good order, spraying for mosquitoes, supporting our first responders, and answering 911 calls. You can still get a building permit and a driver's license. However, we strongly, and I want to emphasize the word strongly, encourage everyone to the extent you can to do your business with us utilizing online services, if at all possible, or certainly over the phone, and the contact information for all of our local agencies will be presented on the screen here. To help slow the spread of this virus, some of the biggest disruptions that we're seeing right now include the cancellation, as was just mentioned, of any large group gatherings, which has seen, among other events, the cancellation of the balance of spring training and the New York Mets preseason. As a result, the following protocols will go into effect immediately at the Mets Clover Park. The facility, including practice fields, is now closed to fans until further notice. Fans with tickets to the 6 canceled home games will be refunded for their face value of their ticket, and the refund process can be found at www.stluciemets.com, and that information will also be on the screen. One of the important requests that we want to make this morning is to our business partners in the community. Please allow employees who are not feeling well to stay home until they're better. This provision is one of the keys to slowing the spread of this virus, and it's critical that we're all committed to this. I know in our organizations we are fully committed to this provision. So with that, let me introduce Nick and Russ and just talk a little bit more from a local government perspective, what we're seeing and what we're committed to.
Yes, thank you, Howard. Again, my name is Nick Mims. I'm the city manager of the beautiful city of Fort Pierce, and I want to emphasize that this is definitely a collaborative effort. We shall continue to work with our community partners, St. Lucie County, the School Board of St. Lucie County, and also City of Port St. Lucie to ensure that we are providing the highest quality service to the general public and to our citizens and residents that we possibly can. We understand the seriousness of this situation, and we are taking all necessary precautions to provide the basic essential services of municipal government. In saying that, I want to relay that we do have one of the largest indoor facilities for the performing arts, and that is our Sunrise Theater. And as Howard mentioned, with the cancellation of spring training, we shall be eliminating and canceling some shows moving forward from this date until April the 3rd. And that will encompass roughly 13 performances and several smaller performances in the small black box performance venue. That is a major blow economically to our entire downtown district and the city of Fort Pierce. And we understand that this time of year we have several thousands of visitors that enter into our city and enjoy the beauty that we have. But I would just ask that we all are patient, we all work together, and just understand that we are doing this to provide the best possible and safest service that we possibly can. In the interim, we have intensified our cleaning and our sanitizing of all of our facilities. And I want to ensure that everyone knows that our basic essential services, law enforcement, public services, solid waste collection, and recycling collection, shall continue uninterrupted. All of our staff are poised, and we are looking forward to continuing our services, and we're looking forward to getting back to a sense of normalcy, and it is our intent to work with our collaborative partners to achieve this mission.
So Port St. Lucie is a large city. We deliver a lot of very essential services. We want to ensure that everybody knows that this is not like a hurricane. We didn't have a 100-mile wind take out, our water and sewer plant. We've not had, damage to our facilities. This is a different kind of event that we're really not used to, but we follow our emergency operations plan that guides us on all crises and all emergencies. And so the city's been following our emergency operations plan. We've evaluated every service that we provide. We are currently at a normal level of service for every service we provide, with the exception of some of the large gatherings that the city would sponsor. Those are they're not required. They're not something you have to live your life and do well on a short-term basis. For example, we did this Saturday, we canceled our St. Patrick's Day parade. We did that out of an abundance of caution. We typically have between 9,000 and 10,000 attendees. We felt like that even though we have no cases of COVID-19 in Port St. Lucie, in St. Lucie County, or for that matter, anywhere on the Treasure Coast that we're aware of, that encouraging 9,000 to 10,000 people to one location was really not wise. We're evaluating other large events that we have in the future, and we'll be looking at each one of those on a case-by-case basis. But we will err on the side of caution. Some of our other events that are smaller, 100, 200 people, we also are looking at those events as to whether they should go forward or they can be postponed. In many cases, we are postponing some of our events just to be sure that we don't contribute to any extension of a virus within our community. So we've heard a little bit from the county and Fort Pierce. Cities provide essential services. We provide services that no one else provides. We provide you clean drinking water. We take care of your sewage when you flush the toilet. Those services, we have plans to continue those services uninterrupted. It may be that due to high numbers of absentee employees, we provide them a little bit differently behind the scenes, but you should not see any change in those services. We've heard that there's a run on toilet paper. I can't figure out why, but we're going to provide water to your house. And when you flush your toilet, your sewage will go away, and we're going to safely treat it. So don't feel like you need to stack up on some goods like you would in a hurricane, where the power goes out and essential services may see an interruption. Your Port St. Lucie staff believes that we'll continue our service level uninterrupted. If anything will be behind the scenes, we'll be adapting to COVID-19 in a different way. So we would urge folks, as Nick mentioned, as Howard mentioned, call us, go on the internet and access our web portals for our water and sewer connections. For our building department, you can, on the internet, schedule a building inspection. You can pay your bills, for water and sewer online. You don't actually have to come into City Hall to do that, and we have seen a significant decline over time in the number of people coming into City Hall. This is a great time to try your e-billing services, and it really helps yourself and helps your city government. So all city services are continuing as normal. Some of the big events that we sponsor, the things that make Port St. Lucie special, have been postponed or canceled, but we expect that to be a temporary reaction as we see more about the spread of COVID-19 and determine, what is normal to us. As was noted early on, this will pass. It may be a few months. We'll get back to normal, and your city governments, your county government will be here providing the services we all need as a community to have a great life.
Thank you. And from the county's perspective, one of the things that we're going to see, I think, immediately are some changes to our library operations. We are going to try to see how we can be assisting our clients at the front door and not allowing too much into the actual facilities, again, just in an abundance of caution. But certainly the services will still be delivered. And I'm sure, just as a side note, and if there's any humor in any of this, it is that we are seeing the usage of hand soap in the bathrooms at record levels. And so what that means is people are washing their hands, and we appreciate that. So if there's an indicator out there that people are taking this seriously, that's certainly one of them, along with certainly the use of hand sanitizers. So with that, I want to thank everybody who came today and shared their updates. It's important that you understand that all of our agencies, including the healthcare agencies, we have emergency operation, continuity of operation plans in place, and we are exercising those plans. It's important that you understand that. Essential services will be continued without interruption. They may, as Russ indicated, just be handled behind the scenes a little bit differently. Last thing I want to be able to say is again, we are a community, and we have faced a number of challenges in the past, mostly storm events, but we're going to get through this one together as we did through all of the other events. But it's important that we stay calm, that we understand that there's individual responsibility throughout this event, and that includes making sure that you have a plan and making sure that we're talking with our family and friends. Lastly, I would just caution, as I do with storm events, that if as you're watching the Weather Channel for hours on end, it drives you nuts. It's important to stay informed, plug into the resources that you need to do that, and then unplug and go do something else. The goal is to be informed, not to be overwhelmed. So be well, stay safe, and thank you very much.